So by the end of this session, you should be able to define some key terms, should be able to outline the main principles or pillars of medical ethics, and also you should be able to discuss the common ethical dilemmas that will always be encountering in your day-to-day practice. So in my introduction, I said this session will enable you, the learners, to have an appreciation of ethical and legal issues in your own practice and apply this to patient care. It will thus enable you to act as a patient advocate. There are sometimes when the health professionals we work with, especially the consultants, they decide something for the patient. But when that decision is not going to help a patient in any way, but they're just doing it to treat themselves or to satisfy themselves about maybe what is the problem of the patient, maybe how they would have done it better during their audit, but when actually it was not going to help the patient. So you, as an advocate for these patients, you'd be there and challenge these consultants and tell them, but doctor, you've ordered for this investigation. For example, you've ordered for an MRI for this patient who is in stage 4 disease and is at end of life care. How is the MRI going to benefit this patient? So that the relatives don't even have to spend the very little penny left on doing investigations that are not going to benefit the patient. So what are ethics? Ethics is the examination of moral life, and it involves making value judgments about what we believe to be right or wrong. So ethical issues occur when the answer to any given question is uncertain or conflicting. For example, you may want to do something for a patient. When you do this, you believe it is benefiting the patient. But also when you do the other way, it can also benefit the patient. When you find yourself one leg the other side and the right leg this side, and you don't know the actual answer to what you're supposed to do, that is an ethical issue or an ethical dilemma. The answer to your question is uncertain. You don't know what exactly to do for the patient. When you think of plan A, it is the right thing for the patient, and plan B is also the right thing for the patient, but you don't know what to do. So that's an ethical dilemma or an ethical issue, and we shall see some of these dilemmas in our scenario. Medical ethics. They guide health professionals in decision making. They apply to all medical care and assume greater importance when caring for patients at the end of life. They are just guiding principles and they are not laws. So as we are taking care of these patients, especially at the end of life, we need to apply these medical ethics.